COVID-19 numbers across the country continue to rise, while at the very same time, more and more people are getting the vaccine or trying to get the vaccine. In today's To Your Well-Being, where are we now with COVID-19? Cone Health's Chief Physician Executive, Dr. Bruce Swords, is joining us. So first and foremost, there's been a whole lot of back and forth about vaccine doses in the last 24 to 48 hours. So give us the latest update from what you know about Cone Health and the vaccination clinics and appointments.
Thanks, Tanya. Thanks for having me on this evening. Vaccines have been a point of difficulty over the past 3 days or so. We at Cone Health and Guilford County have been pretty aggressive about vaccinating as many folks as we could. We had a great week last week, and then on Friday, unexpected to all of us, the state announced that Guilford County Cone Health was not going to get any vaccines this week. And I'll be clear on that, any first dose vaccines this week. And so that means that the 10,400 vaccines, first vaccines that we had scheduled for this week needed to be canceled, and we are going to do our very best to get those rescheduled. So a significant disappointed and somewhat of a surprise from the state of North Carolina.
And at this point, they haven't told you when you're getting another big batch of vaccines for first dose vaccines?
There was a call today with the state and a wide group of hospitals, health systems, and county leaders describing the mechanisms going forward. So I'll be hopeful that next week we'll get some vaccines, but given our experience with the state and last week's experience, we're going to be very cautious in scheduling future vaccines.
Right, and you made a very big point to make sure that you said it was first vaccine doses, because we have a lot of appointments for second vaccine doses. What is the update with that?
Yeah, thanks for asking. Second vaccines should be delivered on time and in accordance with schedules. And so if you had your first vaccine, you likely received an appointment for the second vaccine. It's very likely that you will keep that appointment, even if there has been some communication that the schedule needed to be canceled or the appointment needed to be canceled and rescheduled. If you're one of those people, you'll get further communication and expect to get the second vaccine on time.
Expect to get that second vaccine on time. Okay, because a lot of those appointments are this week. All right, let's talk numbers as a whole, not just for the vaccine, but let's talk about coronavirus and COVID-19 numbers. What do they look like?
At Cone Health, we have seen a little bit of a decline over the past couple of weeks. And so this morning in all of Cone Health's hospitals, there are around 224 patients in all of our facilities. Of course, that is a moment in time and it fluctuates throughout the day. But you can compare that to maybe 280 patients a few weeks ago. And I'll also remind all of your viewers that really three and a half months ago, that number was 30. So we've seen a sharp incline, and maybe over the past couple of weeks, a slow decline, and we're hopeful about that.
All right, I like that thought of the slow decline, at least the decline part of that. And so I guess my next question is, what is your anticipation of the numbers in the next couple of weeks and months? Do you see that continuing?
Good question, and it's too early to tell. And so when we think about that question with our enterprise analytics team, our data scientists are really trying to take all sorts of different variables. What's the decline really look like? What's the positivity rate? How many people are getting vaccinated? What's the mask utilization? Really trying to put that all into a comprehensive view of what will come. Today, the predictive models look like there still will be an increase, and we have to make sure we understand these are predictions. And so given that these variables might change, I'm hopeful that maybe we'll continue to see a flattening or maybe even a continued decline.
So with that said, and we still try and make life happen as life happens, we've been telling people do not put off care because of coronavirus. Are there any new changes about non-emergency surgeries that we should know now?
Yes. Over the past 2 to 3 weeks, we at Cone Health made decisions to really limit non-time sensitive surgeries and other procedures. And given that the numbers have flattened out or even declined over the past couple of weeks, we're going to make a decision that allows for increased elective or non-time sensitive procedures and surgeries to take place. So if you're one of those people that was delayed, you'll likely be hearing from the hospital, the health system, or your doctor to reschedule those procedures.
All right. And we've, of course, been hearing about this new strain of the virus. Let's talk a little bit about what the concerns are, and are there steps to protect against spreading this particular strain, or is it the same kind of steps that we've been taking?
So we've all seen in the news and in the medical literature that there are new strains of this SARS-CoV-2 virus, and that's really not to be, that is expected. It's not unexpected. And viruses, whether it's the flu virus or in this case the virus that causes COVID, all of these viruses mutate all of the time. And some of these mutations can result in viruses that can survive and sometimes even be more aggressive. So that's the concern. We don't know a whole lot about these viruses, so anything that you're reading is all very preliminary information. And we are convinced that the same actions that help prevent people from getting COVID-19, the traditional SARS-CoV-2 virus, will also help protect against these new variants. So same things, wear a mask, wash your hands, stay away from each other, don't gather in large groups.
Okay. And what we want to make sure that you know at home is that Dr. Swords is going to be taking your questions about coronavirus, the vaccine, and all of that. So how you are able to get a question to him to be answered right here on the spot is by texting 336-379-5775. Remember, this is text only, so do not call, and we will be answering your questions when we come back from the break.